Our next session now will focus on two very important topics. The Global Breast Cancer Initiative, which is about promoting health, early detection, and good cancer management, and Ating Dibdibin, ICANSERVE Foundation's own program that helps communities learn more about breast cancer and take action. Now, I would like to call on the moderator, someone who is deeply involved with Just Projects Philippines Incorporated, a faith-based NGO dedicated to protecting and rehabilitating at-risk children, including sexually trafficked children and child soldiers in Mindanao. At bakit hindi? Hindi lamang ito kanser ng katawan, kung hindi kanser ng lipunan. In the healthcare sector, she operates dialysis units across the nation, demonstrating her commitment to improving health services. Mimi is also an avid outdoor enthusiast who loves hiking and working out in the gym, a dedicated volunteer with ICANSERVE since 2005, bringing her passion and energy to support breast cancer awareness and care. Pag-akyat niya, makikita ninyo ang katibayan na walang taga-ICANSERVE na hindi maganda dahil lahat tayo ay maganda. Please welcome Mimi Martin.
Ang ganda ng introduction. What a wonderful introduction. Hey guys, be sure to stay ha. We're running late, but please, we have so much in store for you. So please stay. All right? Why don't we do something like what the doctora did also? You know, you just stand up and work the sugar off. Okay? Come on, stand up. On your feet. We gotta move it, move it. We gotta move it, move it. Let's move it! Okay, there. All right? Are you ready? To hear more speeches? Okay, let's do it! Okay, this is how we rave in the Philippines, sir. All right, so now we can go sit down. Are you ready to sit down and be more attentive? Okay, so good afternoon, everyone. The breakout sessions earlier today provided me with a wealth of learning. I learned a lot from the breakout sessions about what your patient groups and the LGUs do and what your priorities are. Our next session will provide us a global framework so we align our initiatives and shared mission to reduce breast cancer deaths and improve patient outcomes across the world. So hindi lang local, kundi global. So that should be our pananaw, no? We should align ourselves with global initiatives. We should saving our lives and keeping families whole is the core of what we all do. With us today are someone from the World Health Organization and two representatives from organizations who created citywide programs to address the breast cancer burden. Our first speaker is Dr. Elick Narayan, over there. He is the focal point for cancer control, chronic respiratory disease, oral health, and palliative care of the World Health Organization's Western Pacific Regional Office. Wow! Dr. Narayan has extensive experience working with government ministries, international and regional development agencies, civil societies, and academic institutions to provide quality health services for people in the Asia-Pacific region. Before joining as an NCD Cancer Control Technical Officer, he was the Republic of Nauru Hospital Consultant Physician. He has spent some time at Fiji Islands, providing services at the primary health centers and tertiary care centers. He served as a dean and associate professor of the Faculty of Medicine at the University of Fiji, and played a key role in implementing new programs. He is a medical oncologist specializing in lung cancer. Please come on stage, Dr. Narayan. And also, he is very patient man. Even if we're speaking Tagalog and he can't understand a thing, he just sat through it for 2 hours.
Oh, good afternoon, everyone. Okay, that's me, my name there, and that's my designation. And I didn't spend a little bit of time in Fiji. I am from Fiji. Hey, Bula. So I'll start with a very small story. This is when I had just graduated with my oncology and come back to Fiji Islands. Same month, October, and we were preparing for the Pinktober. And a child comes up to me and asks, "What's the occasion?" I said, "Oh, it's the breast cancer month." And she said, "So what's special about it?" I was like, "Well, it's breast cancer month. That's what's special about it." And then she asked me something that really, made me think. She asked, from January till September, does breast cancer occur? I said, yeah, it does. She said, so why is it only in October that we talk about it at such grand scale? And it, made a bell ring in my mind that yes, that is something that is really lacking. That we don't talk about, breast cancer probably the whole year. And then when October comes in, we all jump at it. October goes, slowly the whole momentum dies. I think that is one thing, that one mentality needs probably to be re-looked at. That cancer can occur to anyone, at any time, any month. And we should continuously talk about it so that people are aware that yes, cancer is curable if it is caught early. I was listening. I'm sorry, I can't speak any Tagalog, but what I sort of got out of that, conversations about survivorship. Okay, you can have survivorship two ways. You can live a very miserable life. Okay, every time taking medicine, going through palliative chemotherapy, it's painful, but you live. Or you can be diagnosed early, have a long, fruitful life. The choice is with us. However, not every place is fortunate. So that's what we'll be seeing, some of the realities of what this region, the Western Pacific region, looks like when we talk about, I'll here only be talking about breast cancer, but that is the general reality of cancer in this entire region. Remember, we are one of the largest regions of WHO. WHO has 6 regions, and we are the Western Pacific region, 37 countries and areas. Okay? The largest being China, with over 1 billion people. The smallest being Pitcairn Islands, with 35 people. So you can imagine, the geographical spread all the way from Mongolia right till, New Zealand. That's how big this Western Pacific is. And we cater to more than 1/4 of the world's population. So the burden of disease in our region is naturally 1/4 of the total global burden. Right? We say that now there are countries that are very small that may not benefit from a lot of things that we talk about because they are too small. They can't, well, it doesn't make sense for them to have a radio-oncology center. But then there are those countries that are big enough, but yet they don't have the radio-oncology centers. There is a big disparity in survival between the developed countries, the developing, and the underdeveloped. The survivability itself makes a big, difference when we see the statistics associated with it. So with that, thank you very much, ICANSERVE, for inviting us here. And we'll move on with that. So in 2022, that's the most recent data that WHO has. Our data comes from IAC, which is the International Agency for Research on Cancer, which is part of WHO. And that is the data hub for all the diseases, particularly cancer, where we get all these numbers from. So 670,000, that's globally. Do you think that figure is correct? What do you think? That is what we know. Okay? That is what has been reported. But then what about those countries that doesn't have a reporting system? Okay? What about those cases that have not been diagnosed? Okay? So 670,000 is what we know. So roughly half of all the breast cancer cases occur in women with no specific risk factors. You can be walking normal, no family history even of breast cancer. And suddenly one day you wake up with some pain and discomfort in the breast. You palpate, you find a lump, go to the hospital, they say, okay, memo. And then you find, as it builds up, you find you have breast cancer. And then you keep wondering, why me? Okay. So, of 157 countries, of 185 countries, 157 countries reported that breast cancer was the most common cancer in women. So it occurs in every country in the world. Men are not spared. About 0.5 to 1% of the cases of breast cancer occur in men as well. So let's talk about our region now. In 2022, 575,444 cases were diagnosed in our region. This data is only for 21 countries, remember? And of that, 128,787 deaths. Okay? Again, the statistics for cancer is just like an iceberg. What is reported is just the tip. But there are so many factors playing to it which is below the sea, which we do not know. The unreported cases, the undiagnosed cases, where there is no infrastructure, no screening machinery or diagnostics available. Advocacy, communication, and awareness is low or absent in many of the regions. So naturally, the health-seeking behavior in many of the places is very low. There's one thing that we should realize in our region. Women are very family-oriented. That is true for our region. So if a woman develops breast anomaly, need not be breast cancer, they will sort of bear that pain and everything until it becomes unbearable. That is what we have seen in many of the cases. The reason being, she feels that if she happens to go to the hospital and she is diagnosed of cancer and they remove one of the breast, the chances are that she may no longer have a family. So there are a lot of socio-economic factors that plays into the reporting as well. Similarly, the timing when the patient presents is also affected by our socio-demographic and socio-economic status of the patient. This is something very interesting. This is actually the number of cases that we have, its distribution. Okay, you can see those tall, skyscrapers. So China, definitely, because of its population size, right? It has 350,000 plus cases there. And Philippines is right over there, somewhere around 33,000 cases with 11,000 deaths. This is just a raw figure that we know, okay? Just the raw numbers that's there. But the next slide gives you a standardized, comparison. So this is a standardized comparison. The top one, the first one, that is the global occurrence of breast cancer and the death. The second one is what is the rate in our region, in the Western Pacific region. So those, lines that you see there, the first one is 7.8 per 100,000 women. That is the regional incidence, and the blue one on that side is the regional mortality. Okay? So those are the averages in our region, and you can see which countries are way beyond that region. Okay? If you just see the raw number, maybe 100 cases, you can see some of those countries, for example, Fiji there. If you see the total number of cases, it's 250, 260 cases that you'd see. Okay? But it has a population of about 1 million. The standardized number shows how grave the situation actually is. So breast cancer, along with breast cancer, along with cervical cancer, are one of those cancers that has the biggest inequities. So in high-income countries, you have a survival rate of about 90%. Okay? In countries like India, South Africa, which is very similar to the lower middle income countries, survivability falls down to 40%, 40 to 60% survivability is there. Okay? And the reasons being late diagnosis, inadequate services, low coverage. Majority of the low middle income countries don't have UHC. I'm very happy Philippines is really trying its best to get as much UHC as possible into cancer services. That is amazing. So what is WHO's response? What do we do about it? Okay. So we started what is known as the Global Breast Cancer Initiative. Okay. So what does it do? Its aim is to empower women, build capacity, and to ensure that there is provision of care for all. Okay. So breast cancer death, again, as I said, it disproportionately affects individuals, particularly in the lower middle income countries. And the 5-year survival rate compared to higher income countries is low in our low middle income countries. So what is the objective? Okay, I won't read into that. It's simply by 2040, we want 40% increase in survivorship. Okay? So how do we plan to do it? There is a framework. That's called the Global Framework for Breast Cancer. Okay? So it provides 3 pillars of action for national cancer control programs. Okay? 3 main things that we need to look at. One is health promotion and early detection. That's the first pillar. Okay? You can have various activities linked to the first pillar. The second pillar is timely diagnosis. Third is comprehensive breast cancer management. Which of these pillars do you think is the most difficult in our region? And the management. Okay? Health promotion is okay. Early detection again. Okay? Because advocacy is low. Okay? You don't need, fancy equipment to do an early detection. Okay? You just need to have the knowledge of how to use your fingers, okay, on doing a digital palpation of the breast. But then how will people know when the advocacy itself is weak? The communication is weak. Okay? I was in Fiji a couple of months back, and strangely enough, an advertisement came. Okay? Talked about breast cancer. I was like, okay, nice. Right? But there's something I noticed. As soon as the advertisement came, most of the women got up to heat the food. Why? Because the advertisement came during the news hour. Okay? And right after the news hour, when the advertisement ends, there is a soap opera that starts. Okay? So the timing of your advocacy, your communication, mass media and all, has to be very appropriate. Okay? And I can understand, because if you take the prime time, it's more expensive. But then health is priceless. Okay? There has to be, an investment into health. So we do face difficulties in the diagnostics and management, which means the treatment side, right? Now, sitting here in the Philippines, I'd say very fortunate. You have oncology services, you have oncologists, you have radiation facilities. Go to some of the countries in the Pacific, okay? The only thing they have is a breast surgeon. And he may not be even a qualified breast surgeon, he may be a general surgeon. So the moment a patient presents with a breast lump, they may not even have proper pathology services. You take a lump out, you send it all the way to Australia. By the time the report comes back, the patient has gone from stage 2 to stage 4. Okay? So where you could have actually saved the patient's breast, the patient would end up not losing one, but they will do a prophylactic, bilateral. Okay? And then there is no reconstructive services. Okay? So they remain like that. So I'd say in Philippines, very fortunate to have all these established services. So what is this framework? The GBCI framework and all. Okay? So it's an evidence-based framework that provides a guidance on how to reduce breast cancer mortality. Okay? You can't do much about incidence, remember. Okay? It's not like cervical cancer where 95% of the etiology is attributed to HPV and you have a vaccine for it. For breast cancer, you need not have risk factors. You can just have breast cancer. Okay? So we try to concentrate on reducing mortality. Provide strategic guidance and coordination aimed at reducing breast cancer mortality. And remember, it is evidence-based. It took a lot of time to develop. So that's what it looks like in a very, nutshell, I'd say. So you have pillar 1 that talks about health promotion and early detection. The targets are 60% early stage. Pillar 2 is timely diagnosis, which means that must be done within 60-day period. Okay? And then pillar 3, 80% should have completed their treatment. So that's a bit more about all the pillars there. The KPIs for all the pillars are there. I won't go into that. The table there, that's something that you can have food for thought. So that's how the framework. It's available online. If you wish, you can download and have a look at it. Okay, so it's about assessing, strengthening, and scaling up services for early detection and management. You need not, follow it word for word. Okay, it is a guidance that helps you establish your own national guidelines. So that's about it in a very brief. I hope it gives you a fair idea of what breast cancer is. And as we say, breast cancer is everyone's business. Okay? It's not just you and I. A woman affected with breast cancer, the entire family is affected. Okay? So I wish ICANSERVE Foundation all the best. And thank you very much once again.
Thank you very much, Mr. Narayan. Akala ko dahil pinahintayan natin siya ng 2 oras, magsispeech siya ng 2 oras. Buti na lang hindi. Pero at least tayo, ang UHC natin, I mean, we are among the developing countries, we are moving up there, di ba? Mas may advantage pa tayo. Our next speaker is our very own Dr. Cecille Montales, my favorite. Yay! She's a board member of the ICANSERVE Foundation, Committee Chair on Patient Services. She is also the Chief Trainer for the Clinical Breast Exam Program of Ating Dibdibin, the Community-Based Breast Cancer Control Program of ICANSERVE. She is also the Executive Assistant for Health of the City of Taguig. Under her watch, the ICANSERVE's program in partnership with the City of Taguig qualified as finalists for the Galing Pook Award. Galing! The award recognizes and honors innovative local government programs seen as models for good governance for adoption in other communities. Doc Ces, come join me on stage. Welcome, Doc Ces!
Thank you, Mimi. Magandang hapon po. Okay pa po ba kayo? Medyo pagod na. So bear with me po, kasi medyo mahaba ng konti yung presentation ko. Because I'm here to present a program that we at the ICANSERVE we are extremely proud of, no? So, this is the flagship program of ICANSERVE, the Ating Dibdibin program. Bakit nga po ba kailangan ng isang programa na katulad ng ICANSERVE? Nakatulad ng Ating Dibdibin program. Kinakabahan po ako. Sorry po. Kahit ilang beses na akong nasabihan ni Cara or napagbigyan ko siya na mag-present, lagi pa rin po akong kinakabahan pag nasa harap ng mga tao, no? Especially you, na mga advocates for breast cancer. So, pasensya na po kayo. I was saying na bakit nga ba kailangan natin ng isang programa na katulad ng Ating Dibdibin program? Okay? Here's why po. Well, na-mention na rin po ito ni Dr. Narayan, but I'll mention it again. According to the Union for International Cancer Control, a woman dies from breast cancer every 50 seconds somewhere across the world. Wow, every 50 seconds. The 2020 data from the World Health Organization shows that 2.3 million women globally were diagnosed with breast cancer and 685,000 women died because of it, close to Dr. Narayan's data of 2022 also. The survival rate for breast cancer in high-income countries is 90% compared to 40 to 66% for low-income countries like the Philippines. Breast cancer ranks first in the country as the most common cancer for both sexes, accounting for 17.5%. The majority of breast cancers in the Philippines are discovered in the late stages, with stage 3 accounting for 50% and stage 4 at 28%. Many women hesitate to undergo medical checkups primarily for two reasons. They fear potential cancer diagnosis and the high cost associated with its treatment. The delayed diagnosis is also attributed to low screening rate in the Philippines. The screening rate in the country is at 2.3% only. According to Dr. Partha Basu of International Agency for Research on Cancer, a simple clinical breast exam has been found to lead to an earlier diagnosis and a 30% reduction in deaths. To address this problem, the Ating Dibdibin program was established by the ICANSERVE Foundation in 2008. The Ating Dibdibin program started out as a community-based breast cancer early detection program, but has expanded into a full-blown breast cancer control program through partnerships with local government units. Its goals include lowering the incidence and mortality due to breast cancer, zero out-of-pocket expenses for patients, and improving the quality of life of breast cancer survivors. The Ating Dibdibin program's partners so far are Marikina City, Panabo City in Davao, Taguig City, Muntinlupa City, San Juan City, and Tagum City in Davao. There's one po in the works, but I will not mention the LGU yet. So, the program is aligned by the 3 pillars of the WHO Global Breast Cancer Initiative, or GBCI. It's aligned with the 3 pillars. It's guided by the 3 pillars of the GBCI. So GBCI employs 3 key strategies to reduce global breast cancer mortality. So as mentioned by Dr. Narayan, these are the health promotion for early detection, timely breast diagnostics, and comprehensive breast cancer management. GBCI also established a universal patient pathway that LGUs can use as a guide for breast cancer management that can help improve consistency and quality of care. Each LGU can modify this patient pathway according to their own referral system. Actually po in Taguig, meron po kaming sariling referral pathway. But when I trained Muntinlupa, nakita ko po na yung referral pathway din nila ay effective. So gaya ng sabi, no, it's not a one-size-fits-all. Bawat LGU po, pwede nilang i-customize ang referral pathway nila. By following the patient pathway, the Ating Dibdibin program ensures that patients receive comprehensive care at each stage of their journey, from early detection to survivorship. In setting up Ating Dibdibin, it is important to have a local ordinance for sustainability and legal foundation. Regardless of the changes in leadership and officials, it ensures the continuity of the program. There is also a need to identify the source of funds for the program. Local government units use either their general fund, like in Taguig, or their gender and development fund, like Muntinlupa. And then siguro later, we can use that because of UHC, no? Yung Special Health Fund. We can also tap the national agencies to augment, like the DOH, medical assistance to indigent and financially incapacitated patients. Ang haba po. Nabago na po ito kasi dati mas maigsi lang yung MAIP na to. And then, as discussed po, no, yung tinatawag nating DOH, Cancer Assistance Fund, yung C package of PhilHealth. Of course, we have the DSWD. Meron po tayong mga tinatawag na AICS, no? PCSO, Malasakit Fund, among others. And then, of course, foundations and non-government organizations can also help fund other expenses. In Tagum, na-mention po ni Melina na yung Rotary po ang tumutulong sa kanila. We also need to identify our partners and get the needed manpower. It's also imperative to do a needs and a situational assessment. For the program to be efficient and effective, the Ating Dibdibin program trains the manpower on clinical breast exam, patient navigation, and data and digital infrastructure, yung Circle of Life platform. During the clinical breast exam training, so ito po yung ginagawa namin pag nag-uumpisa po kami mag-train sa isang LGU, no? So tinitrain po namin lahat ng barangay health workers on clinical breast examination. Nung nag-uumpisa po ang ICANSERVE, medyo may mga skeptical na tao na kaya ba ng barangay health worker, hindi po sila nurse, hindi sila doktor, hindi sila midwife, kaya ba silang maturuan on clinical breast examination? Well, I can attest to the fact na ang mga barangay health workers po, especially the patient navigators of Taguig, ay napakagaling sa clinical breast examination. 12 years experience na po yung mga yan. Ang sinasabi ko po nga, no, when I trained Muntinlupa, ang sinasabi ko po, kung ikukumpara ko, sorry kung may mga bagong doktor dito, kung ikukumpara ko ang bagong doktor sa aking mga patient navigators, mas magaling pa pong magkapa ang mga patient navigators ng Taguig. Totoo po yan. They are trainable. Okay. Why are we doing this? Because BHW-driven po yung country. Mas kokonti po yung medical professionals. So kailangan po nating turuan sila at makatulong para sa program. So during the CBE training, we go over the overview of the Ating Dibdibin program and the patient referral pathway. Then we give the pre-test and post-test. Training po talaga to. So may written test, may practical test. So we discuss the Breast Cancer 101 lecture, show the video clips of breast cancer facts and myths. So napakahalaga po na matutuhan nila kung ano yung mga maling akala para ang maibibigay po nila sa community ay yung mga tamang impormasyon. And then, we show the clinical breast exam tutorial, demonstrate the mama care kits, okay? Pag po kami nagtitrain, medyo high-tech po yung ginagamit ng ICANSERVE. In fact, di ko po yun nakita nung time na nag-aaral ako. I just don't know ngayon, no? So meron po kami yung tinatawag na mama care kits, yung breast models ay naka-attach po sa laptop. So hindi po ito parang sali-salita lang, video lang. So nagkakapa po sila sa Una muna ay yung transparent breast model kung saan nakikita yung mga bukol. And then, during the practical test na po, no, so dalawa po yung practical test na kailangan nilang ipasa, meron pong opaque na breast model, meaning hindi nakikita yung bukol. Okay? May 5 bukol po doon, at para makapasa po sa training, dapat makakapa sila ng at least 3 doon sa 5. Okay. Okay. And then, the second practical exam na ginagawa po namin is yung magkakapaan na po sila. Okay? Iba po kasi ang feel ng real breast sa breast model. So in fact, sumasakit po ang kamay nila lagi sa breast model kasi mas matigas yun. And then, pagkakataon na rin po namin na ini-screen namin lahat ng barangay health workers na tinitrain namin. Okay? Okay, so in compliance to the GBCI standards are under the first pillar, no? Ito naman po ang ginagawa ng mga patient navigators. So nagte-train din po kami for patient navigation. So for pillar 1, okay, they refer women to primary care services and early detection programs. They should be well-versed in breast cancer risk factors, signs and symptoms, so they can communicate health promotion and prevention. And then for pillar 2, they shall coordinate the services, expedite admin services, provide guidance to patients, and navigate financial needs. And for pillar 3, they shall coordinate the multidisciplinary teams, promote communication between the team and patients, and ensure patients complete treatments, and attend to emotional and supportive needs. So according to the Philippine Cancer Society, after 6 months of patient navigation at the Philippine General Hospital, patient compliance increased from 18% to 68% in 6 months. Okay. So, ano-ano po yung positive elements ng ating dibdibin? Number 1, importante po to have a champion who can lobby and advocate for the program. So na-meet niyo po kanina si Melina, siya po yung isang good example nito. So siya po yung champion ng Tagum City. She's a breast cancer survivor for 20 years and has lobbied for Ating Dibdibin since 2010. And finally, in 2020, a memorandum of agreement between ICANSERVE and Tagum City in Davao materialized. It's very crucial po to have the political will, okay? Yun po talaga ang importante. I already mentioned about the ordinance to sustain the program, the patient referral pathway, to have dedicated patient navigators, to have partners, and to build a data and digital infrastructure. And of course, it will go a long way if we invest in the necessary equipment, facilities, and manpower for the successful execution of the program. Okay, at this point, let me show you how Ating Dibdibin is being done in Taguig. So Taguig City is the 3rd LGU partner of ICANSERVE Foundation. Okay? But we believe that it has the most comprehensive breast cancer control program. So Taguig signed a memorandum of agreement with ICANSERVE Foundation in 2011 and launched and institutionalized through an ordinance the Ating Dibdibin program in 2012. So matagal na po kaming partners ng ICANSERVE. Actually, namamangka po ako sa Dalawang Ilog because I am a board member of ICANSERVE also, but I'm also affiliated with the City of Taguig. So ICANSERVE trained all 876 barangay health workers of Taguig. No? So isang advantage po ng Taguig, kami po yata ang may pinakamaraming barangay health workers sa country, no, in the Philippines. So they were taught on how to do breast cancer 101 lecture, how to accomplish the breast cancer screening form, how to do self-breast examination, or in Tagalog, Alam niyo po ba kung anong Tagalog ng breast self-examination? Sariling salat sa suso. Muntik ka na, Tita Doris. Okay. So that's SSS for you. Sariling salat sa suso. Okay? And more importantly, how to conduct the clinical breast examination. Yun po ang pinaka-importante. Okay. The heart of our program is our patient navigators. They are barangay health workers trained to guide the patient through the continuum of care. Although we are the third LGU partner of ICANSERVE, Taguig is the first LGU that established the community-based patient navigation system. So the patient navigation program in Taguig was institutionalized through an ordinance in 2018. But since 2013 po, we're doing the patient navigation already. So we currently have 39 patient navigators, one for each 31 health centers, except for those big barangays that require 2 or 3 navigators. Okay? So they were all trained, twice, basic training in 2013 by the Philippine Cancer Society, and then in 2018 by ICANSERVE Foundation and Ms. Carmen Oste of the Cancer Warriors Foundation. Okay. In Taguig, barangay health workers are city employed as job order or casual employees, unlike in other LGUs, where they are just allowance-based personnel of the barangays. So in this way, we are confident that we will have well-trained personnel through the years. So sila po ay city employed, and they are full-time, no? So yung iba po kasing LGUs, ang pag-allowance-based po kasi usually few hours lang yan. And sometimes once or twice a week lang po pumapasok. But in Taguig, full-time po sila na Monday to Friday, and in fact, even during weekends. Okay, the patient navigators in Taguig have the following roles and functions. Okay, they conduct bench conferences and screening, refer patients screened with positive findings for surgical consultation, connect patients and navigate them through our healthcare system, support them in diagnostic services and treatment, help patients get medical assistance offered by the city and other agencies, okay, like the national agencies po. Patient navigators also arrange free patient transport and accompany them. So in Taguig po, meron po kaming program na hatid sundo. Hindi lang naman po ito for breast cancer patients, for other patients na mangangailangan po ng transportation sa pagpunta sa facility na kailangan nila. So example po, even the dialysis patients ay pwedeng mag-avail ng aming hatid sundo program. Okay. They also give emotional support. Ito po isang napakahalaga. Kanina nagkaroon tayo ng workshop on mental health. Okay. So itong mga patient navigators po ay mental health advocate natin for breast cancer. They also accomplish the Just Pink digital patient diary and encode data in the Circle of Life platform, and they also do home visits. Dami po, no? Dami nilang task. Ganyan po sila kasipag. Okay. Actually, sabi po nila, no, kaya ng Taguig yan kasi mayaman ang Taguig. Okay? Hindi po kailangan na mayaman ang isang LGU. Lagi namin pinag-uusapan ni Cara na emphasize mo, hindi kailangan mayaman. Okay? Kailangan lang po nyo ng isang effective patient navigation system. Kailangan lang po na masipag, okay, ang inyong mga patient navigators. Hindi po kailangan, kasi kanina napag-usapan na kung gaano karami ang pwede pong lapitan. Okay? Nandito po si Giselle. Meron po siyang isang patient before na na-interview na hindi naglabas ng kahit isang kusing for her treatment, her breast cancer treatment, kasi ang galing niyang maghanap ng financial resources, no? So, Pwede ko bang sabihin, Giselle, na naka 3M siya sa mga paglapit-lapit lang niya. And then may na-interview naman siyang isa na nagko-complain sa kanya kasi di siya marunong kung paano lumapit at malaki na ang nagastos niya. Okay. So in Taguig, we have key programs or key strategies that include bench conferences that help the public understand breast cancer. So, actually, ICANSERVE po ang nag-coin ng term na bench conference. So, ang ibig sabihin lang po ng bench conference, while they are literally sitting on a bench, waiting for their turn sa medical consultation nila with the doctor sa health centers. Ito na po si patient navigators. With her visual materials, magle-lecture na po yan. Kasi sayang po yung time na pinaghihintay nila. So magle-lecture na po siya. Yung Breast Cancer 101 lecture na itinuro namin, tinuturo po niya yan sa mga pasyente. And then of course, iko-convince niya itong mga pasyente na mag-undergo ng breast screening. Okay, ang breast screening po ay ginagawa ng patient navigators kasi trained po sila doon. Dahil ayaw po nating ma-burden yung doctor, no? Dahil marami na siyang problema. Marami na siyang pasyente for the day. In Taguig, siguro po nasa 100 to 200 patients a day kami. So imagine, wala na pong time para magkapa ang doktor. But, eto lang po yun ha, hindi po kikilos ang isang patient navigator ng kanya kapag may nakapa na siyang bukol. Pag may nakapa po siyang bukol, kailangan po yung i-confirm ng doktor niya. And then the patient navigator will do the navigation hanggang sa makatapos po ng treatment ang isang pasyente kung siya ay diagnosed at even after treatment. Okay. So, we also do dibdiban usapan sa komunidad in all barangays. And even in private subdivisions and private establishments all year round to reach more women. Okay? So, kanina nabanggit ni Dr. Narayan na parang every October lang, ito yung Big Bang. But in Taguig po, all year round, tuloy-tuloy po yung programa. Okay. So, during the month of October, as we celebrate Breast Cancer Awareness Month, we have different activities which help to increase breast cancer awareness. One of these activities is the OK-tober Forum, with ICANSERVE. It's a major cervical and breast cancer screening activity that usually serve up to 1,000 participants. Okay? We also have this Picture Perfect contest where we invited breast cancer survivors to show their journeys in photos that you can now find on social media. And then also every October, we engage our health centers in a friendly competition through the Pink Bestie Workplace Contest. So they have to create the best breast cancer awareness booth. Okay. In 2022, we did the Pink Walkathon, which is a 5-kilometer walk to raise awareness on breast cancer and show solidarity for patients. During the pandemic, we didn't stop the program, okay? So we had webinars or online fora related to different topics about breast cancer, and we strengthened the breast self-examination campaign, okay? And then after the lockdown, kahit po pandemic pa, as you can see dun po sa picture, yung breast screening po ay nagpatuloy. So kahit naka-full PPE yung aming patient navigator doing the breast screening. So in 2023, we added the Buhok Ko, Share Ko event, where individuals donated their hair, which were turned into wigs and given to breast cancer patients. So it's an avenue for donors to help in their own little way. Okay. We also integrate Ating Dibdibin with other health and non-health program celebrations so we can cover more patients. Okay? Lahat po ng celebrations, lalo na kung maraming babae, nandyan po ang Ating Dibdibin. Patients screened for breast cancer are also screened for cervical cancer. Okay. So another strategy po namin last year, yung tinatawag naming Ating Dibdibin goes to malls. Okay? So putting up booths in malls and other establishments. And for this year, we will make the rounds of universities to promote awareness and teach breast self-examination among the teaching and non-teaching staff and students ages 20 years old and above. Pabata po ng pabata ang nagkakaroon ng breast cancer. So alam niyo po ba na ang isa sa early breast cancer detection guidelines ay to do the BSE or SSS starting at age 20. Okay, so we will focus more dun po sa ages 20 to 30. Sa ICANSERVE po, no, ang pinakabata po na merong breast cancer ay 24 years old. Because of these creative approaches and strategies, Taguig screening rate stands at 8.48%, which is 4 times higher than the national average of 2.3% in the Philippines. This shows that Taguig's higher screening rate is a positive indicator for the program's early detection of breast cancer. Taguig also sees a higher number of patients in early stages at 41% as compared to the national rate of 22%. Taguig City also helped establish the Pink Crusaders. Ito po yung aming support group. So ang program po ay hindi nagtatapos sa treatment. So yung part po ng survivorship, yung post-treatment, ay inaalagaan din po namin ang mga breast survivors. So, hanggang doon po. So, this has become the venue for the members to share their experiences, feelings, and coping strategies. So, activities include yoga, dance exercises like Zumba, and lectures on nutrition, urban gardening, mental health, and livelihood training. So, actually, dyan sa picture, makikita nyo, may recreational trip pa sila sa Tagaytay. Oh, di po ba? May mga Pink Crusaders po dito, kaya sila pumapalakpak. Okay. So, the group maintains a group chat in FB Messenger that has 409 members. So, 409 members na po ang aming Pink Crusaders. And of course, they have their group chat with their patient navigators. Okay. So for the timely breast diagnostics and comprehensive breast cancer management, Taguig has a referral system. So our patients diagnosed with breast cancer have easy access to free and affordable diagnostics and treatment. So we have our own LGU-run Taguig Pateros District Hospital or TPDH. No? Unfortunately, in Taguig, wala pong national government hospital doon. Isa lang po ang government hospital doon and it's an LGU-run hospital. Okay. So we established a breast clinic which is well-equipped with ultrasound, mammogram machine, chemotherapy room, among others. And there's also a multidisciplinary team and it comprises not only physicians, nurses, and specialists, but kasama po doon ang navigators. So part of the multidisciplinary team. So we have surgeons who can perform biopsy, mastectomy, and other needed procedures. We also have oncologists for chemotherapy and other management. Taguig City also has partnerships with other government hospitals like Jose Reyes Memorial Medical Center, Rizal Medical Center, and private hospitals such as Medical Center Taguig, St. Luke's Medical Center in BGC, and recently, Healthway Cancer Care Hospital. So these partnerships help ensure the completion of diagnostic procedures and treatment of the patients of Ating Dibdibin program. Okay. So this is the patient pathway po for breast cancer management. I'd like to emphasize lang po na yung second, no, the diagnosis, the entire diagnostic procedure. dapat po 60 days, no? Within 60 days. So we were able to reduce the time it takes to diagnose from 90 to 45 days. Okay. So once positive, the patient will undergo comprehensive breast cancer management. So more women are getting breast cancer checkups and finishing their treatment as a result of Taguig's effective patient navigation system. So you can see po dito sa treatment outcomes namin, we only have 10 to 12% loss to follow-up cases. Okay. So meaning, yung nakakakumpleto po ay nasa 80 to 90%. Okay. Our newest project with ICANSERVE, which we call Circle of Life, established the digital and data infrastructure of Ating Dibdibin. So the patient navigators take the lead in data encoding at the community level, and the doctors and nurses in the hospital with the help of the IT team, City Health Office, and TPDH, our hospital breast wellness clinic. So by analyzing patient data, we can identify trends and patterns, issues and concerns that can empower our local government to develop more efficient anti-breast cancer plans and programs. Sa Taguig po, binigyan po namin ng smartphones ang lahat ng patient navigators para mas madali po sa kanila, no? Especially pag nasa field sila. So real-time encoding po ang ginagawa nila. So we are proud of how the program has evolved, and in so doing, saving thousands of individuals. Most of them are mothers, breadwinners, and community leaders. As of August 2024, after 12 years of partnership with ICANSERVE Foundation, we have given lectures during bench conferences and forums to 205,654 participants and screened 131,663 patients. We have 6,291 patients with remarkable findings. Most of them are benign, don't worry, and around 715 breast cancer patients were treated. Aside from hitting the targets of GBCI, thanks to the milestones we achieved with Ating Dibdibin, we noticed an increased awareness and concern against breast cancer, stronger fellowships and solidarity among advocates and patients, more empowerment and less anxiety among patients, confidence in the government's capacity to help. We share the vision of ICANSERVE in replicating Ating Dibdibin program in more LGUs in the Philippines. To date, Taguig has helped ICANSERVE train the 300 BHWs in Muntinlupa, and we are hopeful that more partnerships will come along the way. Okay, panoorin po natin ng konti yung video kung paano po kami nagtuturo ng clinical breast examination. Saglit lang po ito. So yan po yung tinatawag kong transparent na breast model. So nagpa-practice po sila dyan. May 5 pong bukol yan. Okay, so next. Okay. So because of the program's success, it was recognized as an outstanding breast cancer program in the Southeast Asian Breast Cancer Symposium, National Cancer Summit, and National Integrated Cancer Control Act Localization Summit. These accolades reinforce the program's position as a model initiative of global significance. The city also eagerly shared the best practices of the program with stakeholders and delegates of the Union of International Cancer Control when they visited Taguig. The patient navigation program of Taguig was also featured in a British Broadcasting Corporation article. And of course, na-mention na po ito, we are very proud to be one of the finalists for this year's Galing Pook Awards. And Ating Dibdibin program also of Taguig is accepted for publication by the Lancet Oncology, the leading journal for cancer publication. According to Dr. George T. Ignacio, Director of Philippine General Hospital Cancer Institute, they have seen fewer breast cancer patients from Taguig since Ating Dibdibin started. Due to its widespread information campaign, patients are familiar with Ating Dibdibin program and are confident to avail of its services. In 2021, the World Health Organization, through the GBCI, targeted saving 2.5 million lives globally against breast cancer over the next 20 years. Taguig wants to contribute to this noble fight by serving citizens and providing a way forward for other communities. Our strength is in our passion and adaptability, and we will indeed continue to evolve to strengthen the program, save more lives, and become a model for many more local government units in the Philippines and abroad. Maraming salamat po. Thank you.
Hello, girls. So, there are more lives to save, and the life we save might be our own. Do you still remember how to do your monthly self-breast examination? Kahit na menopause na tayo, we still need to do it. So, to put us in a better mood and be more active, I have been, can you please stand up and we'll just do our breast self-examination? Yes, here. Raise your, okay, stop. Okay, examine the breast, outside, outside. And then, from the nipple, outside, inside, outside, inside, outside. And then, radiating to the armpit here. Okay, are there any lumps? There you go. Okay, basta, remember, round and round we go. Okay, other side. Wala na, pero meron pa rin niya meron pa, malay mo sa armpit, meron, di ba? Oh. Okay, yes. There you go. Are we awake? Woohoo! Yes, now. That was a good, presentation by Doc Ces. Talagang nakaka-inspire. But now, thanks to her, we're very proud of all that she has done. And I am so proud of ICANSERVE that it has been able to partner with 6 cities, going on 7. And the Metro Manila Mayor Spouses Foundation, headed by Carrie Zamora, who spoke yesterday, plus all the other cities. Next up is Dr. Herdee Luna, Research Head at the NKTI section of Medical Oncology. Hindi lang pala NKTI Kidney, but also Cancer. And President of the Philippine Society of Oncologists. She is also a member of the Philippine College of Physicians and is affiliated with Lung Center of the Philippines and St. Luke's Medical Center, QC. She was awarded the European Society of Medical Oncologists Leaders Generation Program Asia 2020 to 2021. And she's also very pretty. Here is Dr. Herdee Luna.
Thank you very much for the kind introduction. So I'd like to thank the organizers for inviting us to this talk. So we were asked to present the society's effort, so from our medical society's effort. So I introduce to you the Act Now Plus, the movement for a 360 degrees organized community, hospital, community-based digital patient education and navigation program for early detection and prompt treatment of breast and cervical cancer. So this is a full program with multi-stakeholders and partnerships, including Philippine Cancer Society, Philippine Society of Medical Oncology, PSO, and Quezon City Health Department, as well as W.H.O, and our city hospitals in Quezon City. East Avenue Medical Center, mostly. So the Act Now is an innovative primary care breast cancer prevention program piloted in Barangay Commonwealth, Quezon City. This initiative leverages digital technology and community engagement to improve breast cancer control and care delivery. So the Act Now aims to detect breast and cervical cancers through screening using integrated patient online education and self-evaluation with mobile clinic with breast and cervical screening. This component includes the breast self-exam, the breast ultrasound, visual inspection with acetic acid, self-collection with HPV test, and navigation to the referral pathways for centers with medical access programs such as East Avenue Medical Center. So from the community, with the easy access to your cell phones, we encourage women to gain access to the reliable sources of information out there. We hope that these information, educational tools, will empower them to seek consultation. We know that in the Philippines, health-seeking behavior is very much high in incidence. And hopefully, our presence into these portals and platforms would educate our patients into bringing them into better navigation towards detection and treatment, if ever found with suspicious lesions. So from cell phone, it has a digital platform accessed at actnow.philcancer.org patients to facilitate community engagement in breast and cervical cancer control. So this was launched together with DOH, QC Health Department, Quezon City General Hospital in February 2023. There's a memorandum of agreement signed as well as with the following components of the program. So you see there the website with online self-registration and education. Community members can access breast health information and register themselves for the program. The ACNOW Plus PCS website portal is adaptable to LGUs and women in the community with access to handheld cell phone with Wi-Fi connection. This can also be adaptable to workplace as well. So you see there above the picture where in Barangay Commonwealth it was launched. Then the portal has also this risk assessment feature and the triage system wherein it analyzes user-provided information to identify high-risk individuals. Mobile clinics will then be deployed with a certain number of high-risk individuals, and the mobile clinics deployed has components of ultrasound screening, and these on-site clinics bring also the screening capabilities directly to the community. These were all inspired during the pandemic, wherein patients cannot go to the hospitals where screening procedures are placed. So this time, the medical team goes to the community in order to capture and save more lives once detected with suspicious lesions. Part of the Philippine Cancer Society's thrust is to train and equip patient navigators. So unlike ordinary barangay health workers, these are cancer-dedicated navigators. We also want to have this community-based navigators dedicated solely for cancer concerns, and also be equipped with the right information in order to guide patients to the proper navigational pathways tailored to that community or that city. So the navigators have a network of navigators in the community and in the hospital. So this has referral system to hospitals with medical access programs. High-risk or suspected cases are efficiently referred to healthcare facilities through highly trained, dedicated cancer navigators by the Philippine Cancer Society. In addition, patient navigated monitoring is done. Dedicated navigators guide the patients through the complexities of the healthcare systems, ensuring compliance and treatment completion. These are the data for Quezon City and also the ACNOW Plus. On your right side, you see there the bus operating since 2013. We have a total of breast cancer screened in around 6,700 patients. Those with detected with breast cancer in 555. Those who underwent biopsy in around 38. And those who diagnosed 10, and currently 6 were undergoing treatment. Cervical screening were also launched 4,000 were screened. Those with patients with positive screen are 49. And then suspicious findings are 4, and also referred to the hospital around 4. So these improve detection to treatment time in 4 to 8 weeks' time, with the navigators in place, as well as communicating directly to the patient. Patient will maximize the information of the from the healthcare system in order for them to minimize wasted time. On your left is the Quezon City Health Department efforts as well, so around 70,000 screened, and we have there both for breast as well as cervical cancer reports. The project, even its beginning, has its values and impacts as follows. It prioritized cancer control in areas where cancer was not a priority. The program has successfully advocated for increased budget and support from Quezon City Health Department, elevating cancer control as a health priority. It also improved multi-stakeholder engagement. The Act now has facilitated the implementation of cancer control ordinance, fostering collaboration among various stakeholders. In addition, there is enhanced coordination and gap analysis. Through its operations, the program has identified critical needs in the healthcare system, such as having dedicated patient navigators. It has mapped hospital resources across different levels and proposed initiatives to determine cancer readiness among health facilities. Grassroots problem solving was also done, and the Act now has improved cancer control turnaround time, cancer care turnaround time from those screened patients to treatment by addressing barriers at community level. It also leveraged technology for efficiency, the triage system and digital patient tracking, and integration with the national registries, the ECESP map and cancer screen have significantly enhanced the operational efficiency. It also expanded access to care by bringing screening and education directly to the communities and connecting high-risk patients to further diagnostics and treatment. ACT now has improved healthcare accessibility. Lastly, it empowered community participation. The program encourages self-education and assessment and trains local patient navigators, fostering community engagement and health initiatives. And with ACT now, we also dialogue for support from the local government through, and this was passed, the Quezon City Integrated Cancer Control Ordinance was passed in June 10, 2024, and these are the essential provisions of that of the ordinance. So you have cancer control, having local navigator, technical assistance in the cancer care, patient navigation and referral, with the focus on community-based patient navigators, also health governance, creating cancer control board with both public and private stakeholders, provisions for health promotion, be it media campaigns for service awareness, as well as targeting behavioral change, increase health literacy, and also social protection programs such as PWD services, transportation and gender inclusivity, having a local registry, harmonized with the national databases, as well as non-discrimination policies, protection against stigma in schools, work, and the community, and funding for sustainability for long-term cancer control. So ACT now represents an innovative, technology-enabled approach to community-based cancer control that effectively improves access, efficiency, and coordination across the cancer care continuum, and its success in Quezon City demonstrates its potential for scalability and wider implementation, offering a promising model for enhancing breast cancer prevention and control in other communities and regions. The program's ability to influence policy, facilitating multi-stakeholder collaboration and address grassroots level challenges, positions it as a valuable asset in the fight against breast and cervical cancer. So as healthcare systems worldwide grapple with the increasing burden of cancer, initiatives like Act Now provide a blueprint for leveraging technology and community engagement to improve health outcomes. The 360 degrees community to hospital to community cancer patient navigation, utilizing community-based to hospital-based registry with reports sent to Philippine Cancer Society, Manila Cancer Registry, and WHO IARC for population-based registry ensures measures for quality improvement in place. Now, I introduce to you the Philippine Society of Medical Oncology efforts. So here we have the successful barangayan at Dr. Paulino J. Garcia Memorial Research and Medical Center in Cabanatuan City on September 18, 2024. These continuous on-site and online cancer education by PSMO simultaneously conducted all over the Philippines. To highlight this initiative, there's 216 barangay health workers in Cabanatuan City who attended the 4-hour discussion with our medical oncologists, and the formation of Cancer Lay Forum included the nurses, the pharmacists of the oncology units, and the medical center of Chief of Dr. Paulino J. Garcia Memorial Research and Medical Center. Here, so this is Dr. Paulino Garcia Memorial Medical and Research Center. And we also have our Barangayan, which is a multidisciplinary collaboration on-site in Barangay Valencia, Bukidnon. So the Philippine Society of Medical Oncologists, in cooperation with the DOH, LGU of Valencia, the Cancer Care Center in Bukidnon, and the Bukidnon Medical Society, PCP chapter, as well as Adventist Medical Center Valencia, spearheaded the first ever cancer awareness campaign in Northern Mindanao. The Barangayan sa Valencia Healthcare Workers Cancer Awareness Caravan was launched last September 6, 2024. This outreach and advocacy event brought together medical oncologists from Cebu, Davao, CDO, Iligan, Marawi, and Pagadian to raise awareness among barangay health workers on how we can increase detection, awareness, and improve health-seeking behavior in the local communities of Valencia City, Bukidnon, and its neighboring municipalities. These are the efforts of our medical oncologists doing on-site training for breast cancer, as well as breast cancer self-exam and also clinical breast exam for the barangay health workers. In addition, there's also the new PSMO AKAP School Iwas Bukol Cancer Awareness Forum for teachers and students in Tagbilaran City that was done in August 31. 250 teachers and students participated in this inaugural event. The launch was in partnership with Governor Celestino Galares Memorial Medical Center, Chief of Hospital Dr. Mutia Kismet, Tirol Macuno, City Health Office, Local Government Unit of Tagbiliran, and Philippine College of Physicians, Bohol Chapter. So aside from medical oncologists in Bohol and Cebu, the event was joined by OB-GYN surgeons as part of the multidisciplinary cancer care team. This is the impressive workshop done. And for the patients, the PSMO has this Cancer Fair 2024 for their wellness. And this is the successful Cancer Fair in Ilocos Norte by the PSMO Outreach Committee at Mariano Marcos Memorial Hospital and Medical Center. Cancer unit staff, around 246 participants, patients, caregivers, families attended this event. There were a lot of activities done here, including lectures, also fun and games for the well-being, free haircut, also giveaways. and not only in the north, but also maximizing all cancer education in the south. No? So PSMO had also the barangayan to Bayugan City, Agusan del Sur. So PSMO has been very active reaching these far-flung areas. And this was held August 17, 2024. 419 barangay health workers and clinical health workers participated in the barangayan at the Lape de Assis Gym, Bayugan City. 14 medical oncologists from all over the country conducted the lay forum on cancer awareness and breast exam workshop. So this is the successful program in Agusan del Sur. There were barangay health workers, cancer 101 topics discussed, as well as, and this one is the training in Pasukin, Ilocos Norte, last August 14, 2024, with 190 barangay health workers attending the event with the help of the Department of Internal Medicine and Cancer Center in Mariano Marcos Memorial Hospital and Medical Center. This is in cooperation with Ilocos Norte Medical Society, Philippine College of Physicians, Ilocos Abra Chapter, and the Philippine Radiation Oncology Society. Back in Paulino J. Garcia Memorial Research and Medical Center, our medical oncologist, Dr. Jason Quintalo, had several lectures as well as prostate cancer awareness and the training on examination to patients with to suspects, prostate cancer suspects. So this is Dr. Jason Talao. And you also have the Negros Oriental Outreach, the barangayan in Negros Oriental Healthcare Worker Cancer Awareness Caravan, done April 27, 2024 at Masias Sports Complex, Dumaguete City. Again, more than 500 barangay health workers from LGUs within Negros Oriental attended this event. Leading the pack to this worthy endeavor were our very active medical oncologists, led by Dr. Gina Makalua, Dr. Janine Torres, Dr. Melanie Chua, and Angel Galispen, as well as Dr. Tuazon. Dr. Josephine Contreras Tolentino, the PSMO President, as well as Dr. Elimig Villegas, Dr. Nelson Laha, Dr. Lopez, Dr. Noemi Alsayoy, Dr. Sanchez, Dr. Mark Ando, and the Chongwa Hospital team also participated and supported and initiated this event. So this is their caravan, and that sums our Philippine Cancer Society as well as Philippine Society of Medical Oncology efforts in closing the care gap. Thank you.
We have one question each for the presenters, and I'd like to request them to please come on stage and maybe dance for us a little bit before we ask the questions. So Doc says, yeah, Dr. Herdee and Dr. Narayan. Right. Gutom na ako. May eclair pa ba? Wala na. Okay. Okay, now I'm going to ask questions. For Elick, what can support groups do to help the Philippines achieve the global breast cancer initiatives? So all of our breast cancer support groups here, listen very carefully. Wisdom is chasing after you and will catch you.
Thank you for the question. Let me put one perspective straight. WHO, being a public health organization, works with the government, directly with the departments of health, the ministries of health. If an NGO wishes to engage with WHO, the proper, the pathway is either to approach your Department of Health. Even if you come to us, we will refer you back to the country office. That is to say that I come from the regional office. There is also a Philippine, WHO Philippines country office in Manila. So if anything regarding Philippine health is needed, the Philippine country office is the responsible office to go to. Okay? And there again, they would probably refer you directly to your Department of Health for any further support that you may need.
So, sir, would you know what the Philippine government has done exactly to achieve the Global Breast Cancer Initiative, or has it done anything?
No, I'm sure they have done a lot. I mean, what we were hearing just now from the, even the PhilHealth, just including the cancer into the UHC in itself is a very big achievement, I'd say.
Okay, wonderful, wonderful to hear that. At least there's something happening, right? It's very encouraging. Okay, now next, this is to Doc Ces. What is the biggest challenge sustaining Ating Dibdibin, pera ba? And how do you deal with it?
Gaya ng na-mention ko kanina, it's not actually money.
It's not money.
Okay, the biggest challenge pa rin is to combat fear. Yun pa rin yung mga pasyente, ayaw nilang magpatingin agad dahil natatakot sila. Hindi lang kasi yung takot of knowing na baka cancer. Nandun din yung takot, yung hindi nila alam kung ano ang gagawin nila to navigate the healthcare system, saan sila lalapit, di ba? So, yun pa rin ang biggest challenge. It's not actually the money.
Wonderful. So it's not money. So you don't think na, oh, mayaman kasi ang ICANSERVE dito sa Manila. Sa kami, we are just a small Pipitsugin provincial support group. No, it's not about the money. So, Doc, ito pa. When patient navigation program was first crafted in Harlem, New York, navigators had to be nurses because the creators of the program felt you needed people with a medical background, with a college education. Now we have a variety: community health workers, social workers, cancer survivors. Your navigators are community health workers. What did you discover about them that you didn't know before?
Well, sa presentation ko kanina, di ba, na-mention ko na nagulat ako na very trainable ang barangay health workers when it comes to the clinical breast exam. Actually, itong recent training sa Muntinlupa, tinatawag po kasi naming valedictorians pag nakakalima sila out of 5 na bukol. Okay? So 3 to pass, okay? 5 valedictorians and 4 salutatorians. And majority of them are valedictorians.
Wow!
So, and even nung nag-train po kami sa Taguig, so yun yung isang nakagulat sa akin kasi lagi nating iniisip na hindi sila medical professional and therefore hindi sila trainable. So, but we discovered they're very much trainable.
So that's what you can tell when you go back to the provinces. That's what you can tell them. Don't be insecure because we can actually be trained, all of us. So for Dr. Heidi naman, these are the questions. What is your skincare program? No. Joke. How easy or difficult was it to teach women to use the Act Now app Does everyone in QC have a smartphone?
Yeah, so we want the ACNOW program was conceptualized that we need to track them because the pandemic. No, we
Doc, pwede louder. Shout a little bit. Yeah, there.
So the ACNOW program was conceptualized because the community is not going to the hospital for screening, for active screening because of the pandemic. So we need to somehow know where they are so that we could capture them and bring them to the journey of diagnostics, treatment completion, and then return back to community. The challenges are a lot, no? So in some areas of Quezon City, there are it's supposed to be a Wi-Fi
no signal.
wired community or city. So not all patients or citizens will have a smartphone. The elderly might not be
Able to
to read right away. So we had the navigators trained in the health centers to assist to encode. And also, it's like a sort of interview na rin po. So that aspect we need to improve on. But it's very convenient for those who are at home, who would like to check reliable sources of information about their breast health, breast cancer, and also the Ating Dibdibin video material on self-breast exam is also there in the portal. So there are challenges, but we're trying to do our best to complement and find solutions to these challenges.
Yeah, I think also, kung nakaka-TikTok at nakaka-Facebook, makaka-ACNOW app. I mean, it's just a matter of siguro making it, spreading the news and making it more fun for everyone. Not that cancer can ever be fun, but sometimes, pwede na rin. So, how would you advise other local government units without a breast cancer control program to set up their own?
So,
Talk to ICANSERVE.
Basically, Dr. Ram mapped out the success formula a while ago. No? So we need to have a champion, like Claire, of champions, and then a multi-stakeholder effort. So it's nice to have forums like this because it's community building where we feel stronger, and then at least we could have the same voice to talk to our legislators. It's very difficult because it's really like matching. The priorities of the ones you talk to might not be able to have the same priority as you. What you value might not be the same as they value. So the challenge is how you make them value what you value, no? And in the whole journey, there are so many learnings along the way because one single effort might not, sustain. Now you can have single initiatives and then it could fall down again.
Yeah.
So we need a community,
champion.
champion as well as community to support this cause.
Just like our Tagum speaker earlier, I forget her name. Melina. It took her 10 years before she was able to establish an Ating Dibdibin with her LGU. Talagang dogged perseverance. So all of us mga survivors, that's what we can do also. Talagang kulit ng kulit. After a while, we're gonna find somebody who can also be interested in the same things that we are. And then something will happen. So titration point will occur. The water, the solution will suddenly turn pink, diba? From clear to pink. So, on that note, let us sing. So thank you very much, and that concludes our workshop. The picture.